Good afternoon and welcome back to this much awaited special heart-to-heart session. Sadguru will be very graciously answering questions on our institutions, our service model, our guiding philosophy and many more interesting topics. Dr. Sunil Gavaskar will be posing these questions on behalf of us and later the floor will be open for a few questions from the audience too. Dr. Sunil Gavaskar needs no introduction in a cricket-loving nation as India. After a successful career representing the sport and our country, today, in what he calls his third innings after cricket and commentary, he serves as an ambassador of hope for thousands of needy children with congenital heart disease through the Sai Sanjeevani hospitals. Over to Gavaskar ji.
Om Sai Ram, with my most humble pranams at the revered feet of Sadguru Sri Madhusudan Sai. Let me confess that facing the best of fast bowlers in the world has never been as daunting as trying to ask Sadguru any questions. I can only say I'm very nervous, but also very excited because I myself have always believed that in cricket as well as in life, it's all about learning from every moment, every day, and trying to get better in whatever you want to do. I might just start by saying that there is a fair bit of similarity between, say, cricketers and the pharma industry. In the sense that when the players are playing for their country, they are also at the same time with their performances giving so much of joy, when they do well of course, so much of joy to the thousands and millions who follow the game. The pharma industry does that as well with the medicines that they manufacture to relieve the pain, to get people better. That is a similarity, but there's a major difference as well. The major difference is while the players who do not know, many of those thousands and millions who are praying for them to do well, who are praying that their favorite player and the Indian team does well, the players very seldom get an opportunity to thank them. As far as the pharma industry is concerned, it's the other way around, where so many who you cure with your medicines want to thank you, but don't know who to thank. So while there are similarities, there is also just that major difference. But let me not take you too much into that. Sadhguru, with your permission, may I ask the first question? So in your inaugural talk yesterday, you spoke about the universalization of healthcare and how we can begin with this concept from Bharat. And healthcare is also getting commoditized, like you mentioned today. Can you please throw some light on this concept of universalization of healthcare and your vision, and how will your hospitals and medical college participate in this wonderfully glorious concept?
As we all know that health is a fundamental right. Anybody who is sick deserves a treatment that can cure them, because without good health, we can't do anything in life. To do good or even to do bad, you need good health. So, in India, since ancient times, being one of the oldest civilizations, naturally it is so that the health was ensured for all the people. That's how we survived these many centuries and millennia of civilization. And there should have been some mechanism by which this was being done. The Vaidyas in India in those days were actually not just individuals, they were institutions moving on two legs. They knew everything about medicine. They even knew how to prepare their medicines, whatever they were giving to the patients. There was no pharmaceutical industry at that point in time. So Vaidya himself knew what medicines to prepare through his indigenous knowledge system and administer it to the people who were coming for treatment. And naturally, even in those days, there must have been social disparities, financial inequalities. Then how did we ensure that everybody got this healthcare, universal healthcare? It's only by not charging the patient for something as basic, as fundamental as right to good health. So Vaidyas were always treating patients based on their need. And patients, out of gratitude, would offer whatever they could to the Vaidya. Or in some cases, if the Vaidyalaya, the institution of healthcare, was affiliated or patronized by the local temple, or by some institution, or by the king, or even by some rich philanthropist, they would look after the welfare of the Vaidya, who was in turn looking after the health of the people. So it was a societal effort, it was a concerted effort of the society. And one reason I can think of is that maybe that time infectious diseases were more, communicable diseases were more. It means if one fellow gets an infection, the whole society will get an infection. Therefore, they were more aware that everybody's health is assured only if every individual is healthy. If you have some sick people suffering with some infection or some disease, it may spread to the community and everybody will suffer together. So probably that was one reason why kings and philanthropists or even Vaidyas, as a matter of duty, they provided these facilities for free to all the people in the society. And as I again said, yes, there were costs involved, but those costs were largely covered by the grateful patients who could afford to give something in return to Vaidya. It need not have been money. It could have been some article, whatever they produced or they crafted, whatever was their capacity. And whatever was not enough, the temples and other people used to kind of fill up the gap. With the onset of modern medicine, this thing has changed. Because from infectious disease, I think that is not such a big problem anymore. COVID was an exception. That's once in a century thing. But generally now it is non-communicable diseases. And many other are lifestyle diseases which are not really plaguing or troubling everybody. So in that case, people are not sensitive to the idea that everybody should be healthy for the overall societal well-being. And over a period of time, with the advent of technology, a lot of research and investment that went in. It's not that our Ayurvedic doctors or the rishis did not do enough research. They did. But monetary gains out of the research was never their expectations. And medicines were prepared largely from plant-based ingredients, which they could grow in their backyard or take it from the forest or wherever it was available. The population was also smaller comparatively. But today the dynamics of healthcare has changed. One, as I said, the type of disease is different. The profile of people is different. And the ingredients that are needed to produce medicine is different. The technology investment, research investments that you make. I was told that the pharmaceutical company people will agree that probably for $1 of the market price of the medicine, the actual cost may be less than a cent. The rest is taxes and the research and innovation costs and so many other things, distribution, marketing. Therefore, in those days, all these were not there, so cost of healthcare was far lesser, far more localized. There are many more Vaidyas, and therefore it could be delivered very easily. Today, with a large population, a large world, if you want to achieve the same thing, then I think all units of society will have to come together. The one who is sick is naturally going to suffer, and whatever the savings they have, they will have to spend on getting the healthcare so that they can survive, let alone thrive. Just surviving will be an issue. But the rest of the society which is healthy, what are they doing is my question. Most of them say we pay our taxes. Now it's government's job to do all these welfare things. It's not our duty. But most of the governments of the world are already stretched. They do not have the capacity or whatever the budgets to take care of the entire population's well-being. So at that point of time is when our Indian idea of sacrifice, tyage nahi ke, amrutatva manusha, that through sacrifice alone we attain immortality. So when each of these units of the society, that includes the governments, whatever they need to do, they must do diligently. The larger society, which are institutions, businesses, corporates, they must also pitch in to provide healthcare to the people who absolutely cannot afford, that is the first priority. And even those who can afford a little, if they give away whatever they have, they will go into the same bracket of poor or below poverty line. So even they have to be protected. Those who can pay for themselves, definitely there are ways they can save themselves. So for the rest of them, the underprivileged class, the remaining people of the society have to come together. And as doctors also, because the cost of healthcare education is so high, naturally they need to recover the investment. Because of that also healthcare costs have gone up. If we can subsidize the healthcare education or make it available at a much cheaper price, or find other models of participation, sponsorships, scholarships, we do not know which way. We can take care, but if we reduce the cost of healthcare, education, that's another aspect that can make healthcare universal. So largely I see it as three-pronged approach. One, the society in general, which is healthy, must also worry about the society which is not healthy and take care of it with their resources. It could be personal resources, collective community resources. The governments have to, as I said, find ways to diligently deliver this healthcare efficiently, especially to the rural masses where the access is lower. And they can work with like-minded NGOs like us so that it can be delivered better. And as I said, healthcare education costs, that can be brought down further. Then I think the universalization of healthcare can happen at some point in time. And more than anything else, I think if people also are aware that remaining healthy is a choice. Some of the things, genetic issues, congenital issues, or issues which are beyond the control of people, I can understand. But largely today, NCDs are all lifestyle issues. This is a choice they make, what they eat, what they drink, and how they live. If those choices can be made better, it will reduce the healthcare burden on everybody. So my idea is that those who can afford to remain healthy, please remain healthy. That way you will save a hospital bed. Even if you could pay for it and you thought, anyway, if I fall sick, I can anyway pay for the healthcare. Yes, you can pay for healthcare, but because of the artificial demand that you have created by falling sick, you're denying somebody the bed. And therefore, these issues are there. So it's a multi-pronged approach, but I think government, society at large, individuals and NGOs like us, we all work together. It's possible to universalize healthcare. Again, as I said, it is for those sections which are absolutely not capable of affording it. The capable class can definitely pay for it in certain places. But as I said, if capable class also does not fall sick, then they can use those resources for the betterment of the rest. So I think it's a collective approach. That is what I'm thinking. And this is how the ancient Indians lived, being concerned about each other and provided for each other's requirements without thinking we are different. That is the idea of Vasudhaiva Kutumbakam. If another member of your family falls sick, you step up and help. You don't think, why should I help because I'm not sick, he's sick. You think it's part of our family, so we must do something. And that idea is the universal idea of considering everybody as our own and therefore working towards providing that. And I'm sure if we all work together, may not be in the next decade, but in a couple of decades we can achieve something like this.
Thank you. So clearly, I think a healthy society is a happy society. What are your ideas around setting up a pharmacology course as part of the allied courses with the medical college?
This suggestion has come before also and even during this conclave, that why don't we have a pharmacology course? I think it is necessary because while pharmaceutical industry produces medicines, its right kind of distribution in a legitimate way is also very important to ensure that the patient is getting the best out of all the efforts being put. And pharmacology is a course that we are now going to really think about seriously and provide an opportunity for those who want to be in part of pharmacology industry, or they want to be pharmacists and things like that. But even otherwise, I think I would request those who are MBBS students, nursing and paramedics to also learn a little bit about all these things. Because as I mentioned, in ancient times, Vaidyas were like one-stop shop for everything. They knew everything. They even prepared their own medicines. And I'm sure in a couple of years ago, maybe when you were children, people prepared their medicines at home using a mortar and a pestle, and that is what was administered to the people. There were no injections and no vials and pills and whatever syrups. So the idea is that anyway, all MBBS, nursing, paramedical students, and anybody who's involved with healthcare should have an idea of the entire healthcare system that includes pharmacology. But specifically, we are now looking at building a course that will further help us deliver rural healthcare in an appropriate way, in a proper way. Technology is helping us bridge the gap by giving teleconsultations, but still we need somebody at the ground level to administer medicines. So I think for that sake also we must think about it, and we are now seriously thinking about it.
For everything, partnerships and collaborations are paramount. This morning you said partnership is the only way forward. All your three verticals of health, education, nutrition are based on the ethos of Sarkar, Samaj and Samstha. With so many leaders from the health sector seated here and those watching us live, can you please talk to us about the importance of coming together as a society to uplift everyone without any boundaries?
I think partially it has been answered in the very first question, that why we should first of all look after each other. Because we are one world family and everybody deserves right to good health. And if they cannot afford it, it's our duty to provide for it. So governments have taken great steps. I think universal healthcare is something that was started through National Health Scheme in UK, from where this idea was mooted, and it's been running for a couple of decades now. Slowly, many other countries, from Switzerland to the US to many other, Japan, and everybody took to this route of universal healthcare in their own models, customized to their own countries. And in recent times, India has taken this step under the Prime Minister's universal health coverage scheme, that is PMJ Ayushman Bharat. And so government is doing its part. But the biggest problem is the quality of healthcare delivery at the rural doorsteps. Does government have the bandwidth to do that? It can always bring insurance schemes, and a lot of private hospitals are empaneled with Ayushman Bharat. And I was told that around 27,000 hospitals in India are empaneled. It means they can take the patients who are eligible under the Ayushman Bharat scheme and treat them. But a quarter of them are not even actively participating. So out of those 20,000 hospitals which are active, 15,000 are government hospitals. And only 5,000 are private hospitals which are participating. And these hospitals may not be there in the remote, rural or poorer areas. For instance, in Karnataka or in larger, better geographies, you have under Ayushman Bharat 16,000 admissions per 1 lakh patients. Whereas despite the scheme having given so many cards, in a state like Bihar, it is just probably 600 or something admissions per lakh of people. This is only because the hospitals which are there, either they are not fully functioning, or they don't have all the facilities, or there are no hospitals in the first place. So that's where private sector or NGOs can come into picture. While private sectors have a profit as one of the reasons why they're running, but if they can keep certain part of their profits or certain beds or certain facilities aside in a subsidized way, I think that will also help. And they can be incentivized by the government by giving them tax benefits and other incentives. Similarly, NGOs like us, which are working totally on a free basis, we have to be incentivized, we have to be motivated. So I always was mentioning even schemes like Ayushman Bharat, the card rates are there. Sometimes private hospitals are not happy with the amounts being given against the procedures, so they don't take it up. Or even if they take it up, the patient ends up paying out-of-pocket expenses despite that card rate. So it actually defeats the purpose. So our hospitals, which are totally free, even there are no out-of-pocket expenses for the patient, which is one of the larger reasons why people are going bankrupt. Because there are a lot of expenses that is not covered by insurance schemes or any other mechanism. We take care of that. The patient's attendants, their family, whoever is attending to the patient while the patient is admitted, is also given accommodation and free food for that tenure of stay. So this all should be recognized by governments, and encouragement should be given to organizations like us. The other thing that I want the industry to participate in is, whatever be such schemes and their card rates may or may not be sufficient to run the system profitably or even at a break-even level. It may always fall short, like we notice at some times. While we run it very efficiently, despite that, that money may not be sufficient. That's where we look at pharmaceutical industry, manufacturers of equipments, consumables, to come and participate as a part of their CSR, or even go, as I said, beyond the call of duty, to do something for NGOs like us, so that that cost of pharmaceuticals or consumables or devices or whatever technology that we have can be subsidized or reduced or even made zero. Then we will easily fit into these government's budgets, which are otherwise sometimes not very practical as per many people. So I think efforts have been made, but they're all they all need to work together. The Ayushman Bharat scheme should work with a hospital like us, which wants to serve the rural poor and cause no out-of-pocket expenses. And industry, the supporting industry for healthcare system delivery, they should participate to subsidize the cost further. Then I think this will become a very workable model. Otherwise, most of the hospitals are shying away. So this partnership, what Samaja Sarkara Samstha is this. Sarkara does this part of giving right kind of schemes, policies, incentives, and encouragement to right kind of organizations. The society at large, the healthy people, as I said, they should look after the health of those who are sick in terms of providing some resources for that and reducing the cost of education and other things that are indirectly affecting the cost of healthcare. And industry in general, especially those from healthcare industry, if they can also go beyond the call of duty and do something to subsidize this cost further for NGOs like us, I think we can create a much, much more effective and workable model. That is my idea of partnerships together. And we should do it in the spirit of one world, one family. You are not because you're obligated or you are forced because you're mandated. You should do it out of simply this sensitivity towards the suffering of other human beings who are less capable of providing for themselves. That itself should look after the overall requirement of healthcare in India.
Bhagwan Sri Sathya Sai Baba always said that physics is useful, but it is only information. But spiritual life is transformation. To me, whether the word is physics or science, I understand that whatever we do, it must be done to the benefit for another person. And you have always said, every service activity leads to our own transformation. But we lead busy lives. How can the work that we do every day become the reason for our transformation? And what is the process?
See, this world is called as Karma Bhumi. It means everyone who is born in this world must perform actions. Nobody can escape actions. That is why such a huge portion of Bhagavad Gita is dedicated by Lord Sri Krishna to explain Arjuna what is action, what are the types of action, how the action has to be undertaken, how should one deal with the results, and how action transforms the performer of the action, the doer of the action. So that's a lot of detailing there in Bhagavad Gita. But how do we use our actions to transform ourselves when they are not necessarily, let us say, spiritual, as they think what spiritual is. But I have actually redefined spirituality and godhood. I simply say all good is God. And all service or all selfless work is spirituality. Now you may say, then if I'm working for my family, going to office, earning a salary, and doing whatever it needs to be done, am I being spiritual or not? Because it seems like that's a selfish pursuit. I'm looking after myself and my family. But my understanding is that it is just the way you look at it. If it is not driven by greed, but by need, then I think every action is permitted by our scriptures. And they're all spiritual actions only. For instance, you work so that you provide for your family as a husband or as a man of the family or as a breadwinner. It is your duty to provide for your family. If you don't provide, then that family will become poor and that will become a burden on the society. Children will not get education. Elders will not get their health care because you did not look after them. So that way you have actually caused trouble to the society. So if you just do your duty honestly, ethically, legally, and do it with the sense of devotion, in the sense you are doing it because you're devoted to your wife, your children, your duty towards your family, your elders, and if you have a little extra beyond your requirements, you also help the people who are around. And that kind of life itself is a spiritual life. In fact, in India, in ancient times, there was nothing called a separate spiritual life. Everybody led a life which was already spiritual. Whether they were kings, they were, as they say, Brahmana, Kshatriya, Vaishya, Shudra, all these different categories of people, they all followed their dharma, and that is spirituality. And dharma to me means doing good. Good in the sense, whatever be your profession, you do it well, to the best of your abilities, to give the best to the society as an outcome of your efforts. And yes, money will follow, name will follow, certain positions, accolades will follow as a natural outcome of doing good in the society. But you don't run behind them. That is the idea of karmanyavadikaraste. You do, your right to action is definitely your right. Right to fruits of action is something that Lord does not permit because he thinks that then your results will become more important for you. Then you will not be able, like you are a cricketer, if you go with the idea that you have to win the cup, that's a different way of looking at things and that creates a different pressure. You play for giving your best on the field, your performance definitely is far better. You don't undergo pressure. So this is the attitude. I do actions because I am bound to do actions. Let my actions benefit those who are dependent on me and also those who are around me. That's good enough spirituality. If everybody does their duty in this world, do you think you need an organization like us to look after people? Because everybody has been looked after by somebody. That is spiritual life. So goodness is godness. Or I also tell children, GOOD is good and God is God. So every good is God. If you don't know God, don't worry. Just do good and you will know what God is. And that is how we must teach the next generation that doing good is spiritual life. You don't have to separately go to temples or pilgrimages. You can do that if that gives you joy. That's our culture, that's our tradition. We should uphold that. But on a daily basis, as you ask, how can I do things? This is how you can do. Whatever you do, do it for a greater good of all. As a cricketer, you do greater good of the nation. Or as you said, give joy to the people who are watching, who are cricket lovers. That's your duty, you're discharging well. And I'm sure if you do that, all people do their duty. The society will be looked after. Nobody needs to start the NGOs to take care of the less privileged because somebody is there to look after somebody. That is the idea of spiritual life.
In your interaction with the Honorable Health Minister, the need for capacity building in healthcare was discussed. What are some of the things people here who are from the healthcare industry, what can they do to help?
Yes, as I said, capacity building in a country which is growing every year by 2-3 crore people is a must. If we do not build capacities, we will not be able to deliver all these services to all the people of the country. So when I talked to this about about capacity building to the minister, he was very excited because he felt that somebody is thinking in those lines. So now a lot of initiatives of the governments are also coming up on skill building, capacity building, and many educational institutions are being set up, almost medical schools in every district, and a lot of nursing schools. All this is towards capacity building. But what has happened is that for a couple of decades, we did not foresee the kind of requirement that we would be having. And we didn't work towards it in the sense, we didn't produce enough academicians. We have doctors who are specialists and who are working in corporate hospitals and they're generally doing clinical work. Teaching part, not many have taken to the path of teaching. So today we don't have enough professors. So even if you build an infrastructure, you don't have people to run them. That is because probably the compensation was not as high or whatever be the reasons for that. So how can industry help? Please help set up centers for capacity building, help subsidize the education cost of these centers so that even the poorer people can afford. And that will help them also to participate in the mainstream. Now, just an example is NEET exam is undertaken by the students in India to get eligible to participate in the medical education system. Almost 2 million people, that is 20 lakh people appear for the exam. 10 lakh people qualify. But there are only 100,000 seats in MBBS or so. Out of that, 50% is in the private sector, which is charged at some are very exorbitant. And the public sector seats are also there, but not everything is free. So when you look at that, really there are 900 more aspirants who could have been participants in this system and capacity building could have happened, but they are not going to participate. One, because there are no seats. And even if seats are there, they're expensive, they cannot afford. So money becomes the reason why they are becoming doctors. When money is the reason why you're becoming doctor, then naturally after becoming doctors, money again will drive you. You will not think of serving. So industry can come together. If these industries can set up healthcare institutions or educational institutions, and if they can't, they can work with people. Now we are also trying to work with the government to improve the medical education in with whatever way we can. And exchange program is one of the way AIMS Delhi has participated in this. Some of the people are here. It is only to learn that how can we need not reinvent the wheel every time. I know something, your students can come over and learn from us. We know, you know something, my students can go over and learn. So kind of a seamless integrated system of education. So I don't have to keep making new buildings. Running a medical college for that matter requires a lot of infrastructure. So these expenses can be brought down. It means that much more money will be available to do more institutions. And if industry can participate and patronize these institutions, especially those which are trying to reach out to the, what you call the underprivileged sections of the society, I think these will thrive. And I see the commitment from the people who come from rural area. They're grateful when their education is of no cost. And they're grateful that their parents didn't have to go through a burden of debt and things like that. Look at a country like America. I go there often for various reasons. And one thing I go is to learn about what they do and how can we do better by learning from them. But the student debt is there. An average student carries a debt of minimum $10,000. Average debt is there. And overall, the total debt will be something like 2 trillion US dollars. The total student debt. Imagine their population is only 33 crore people. Let's say students are even 1/3 of it. Even then, the kind of debt they carry on their shoulders does not allow them to think of anything other than repaying it. So naturally, they are always looking at making money, and that becomes the priority, which is why all these institutions are not running properly. Now, if we can avoid that crisis in India by industry participating, and again, as I said, whichever industry participates in such ventures, government should find mechanisms to incentivize those industry people. That you have patronized a medical school and you are trying to give medical education at low cost or no cost, you should get a certain incentive for that. And that will help in capacity building. So these were several of the ideas that were discussed. But the large part is that he was very excited with the idea that students can go over to other institutions. We are breaking the boundaries and barriers and allowing knowledge to flow. As Rabindranath Tagore said in his poem, where the mind is without fear, let the knowledge be free. Let there be free flow of knowledge, not free in the sense financially free, but at least there should be a free flow of knowledge. With technology and all this, I think we should do. And we have people from AIMS Delhi, they said they will take certain classes, they will do some training programs, CME program. And that is the way to go. We can build capacities faster and better.
Apart from the various technical aspects and ideas, if there is one takeaway for everyone attending this healthcare conference to lead better lives both professionally and personally, what should it be?
Do good in everything that you think of. Think how it's going to benefit the last and the least person in the country. That's what is Gandhiji's talisman. It is generally printed on books and many of the school books. If you have studied in any of the central government schools, your books will carry that Gandhiji's talisman. So it's a mantra, and he says that whenever you're in doubt, recall the face of the poorest or the weakest person that you have ever seen. And then ask yourself the decision that you are contemplating on. Is it going to be of any use to that person? Will it restore him some kind of a control over his destiny? In other words, will it bring Swaraj? In the sense, free him from the shackles of poverty and all other social evils. Will it do that or not? Ask this question. And if your answer is yes, it will help the person, then go ahead and do that, no problem. So that is the question I think we should ask every time when we think of doing anything, whether it will help the last person in the line. And if yes, then go ahead and do it without fear, without hesitation. That's what we do. I always ask this question to myself. Will this help the last person? Will it help the poorest? Will it help the weakest? If yes, whatever be the cost, whatever be the stakes, we go all out and do it. And that's why we are so successful in what we are trying to do. And this can be done by anybody.
And finally, compassion and love, cornerstones of your mission of service and spirituality. And your model is a compassionate healthcare model. How can everyone become more compassionate, and what is that sets this institution apart?
Actually, compassion is a very natural ability of all beings, not just human beings. Everybody has compassion in them. If you think of a small baby which has never been taught about the differences of our people and their people, it's always sharing things, it is always compassionate. It's only when we start teaching, don't give this to them because this is yours. That's when we kind of corrupt the baby. And then they start thinking like grown-ups and start differentiating. So compassion is a very natural phenomenon, and that is a very basic human nature to be compassionate. We have forgotten about it because we have been taught what you call being street smart and being clever, being manipulative, and that is what is called as being smart in today's times. So that is, we have ruined it, but otherwise compassion is very common. Everybody's heart melts when somebody is in pain or suffering. However, their compassion is not intense enough to cross the threshold and turn into action. So actionable compassion is only of use to the society. Just compassion in the heart means nothing. You can feel for the person, you can be sensitive, but it doesn't lead to anything, you see. So that compassion which is so much intense within you that it converts itself into some meaningful action, that compassion is what we need to teach the world. Compassion everybody knows. Action after compassion is something that we have to teach. But why we get scared? Because we think if we give away, if we do this for others, what will happen to us? Because they've been taught this from the beginning, that you have to look out for yourself. Nobody is going to come and help you when you are in trouble. So keep your things for yourself. But there is a greater universal law, a cosmic law at play. And that law protects those who are selfless, who give away. And this is the best example, these institutions. We have never thought of hoarding anything, or we have never thought of worrying about how we are going to run if this is all free. And every time this question arose, we asked ourselves, that if selflessness is a power of the universe, then we must believe in that power. And if I don't believe and you don't believe in this, then what do we talk about it to others? So those who are selfless, they can achieve anything and everything. And all the great revolutions, reforms, transformations in the society have happened due to selfless people. Just now I mentioned Gandhiji, a barrister by profession, educated abroad, having a good life, but decided that injustice in the society is not correct. He must do something about it. From South Africa, he came back to India and started a movement. All his life, he was you can easily say he was a pauper. He was a beggar because he had nothing of his own. But what did he do to the nation? Now, he brought about a movement in the country. He woke up the sleeping giant that India was, and made them realize that independence is their right. So take any of these great people, even the richest people, if they had not thought of somebody else and done things. Many pharmaceutical companies, they tell me, they started because they saw a problem in the society and they wanted to solve the problem at the lowest cost to the patient. That's how many of these industries came up, and now they're doing very well. So many of these ventures had their origins in compassion, selflessness, and such virtues only. It's a it's a different matter that over a period they have become structured, organized businesses. That's fine, they are also doing, but core of their value system should be compassion, and that compassion should be actionable. So pharmaceutical industry, which starts off with this compassion for the people, that I want to give this medicine at the highest quality at the lowest cost to the poorest patient, and starts an industry, nothing wrong, that's compassion in action. So this I tell our hospitals are nothing but compassion in action, not just compassion in feelings. They are being actioned, and that is what the world needs to learn. So I told, if they see this model, that it works, because we have read in theory about compassion is important and good. But does it work? We do not know. People need to see it working in front of their eyes. So these hospitals, schools, Annapurna nutrition program, these are all models of compassion in action, which are scalable, which are sustainable, and which are very inspiring. I think younger generation will take inspiration from these. So we need more working models, more role modeling about those who are actioning the compassion in their hearts.
Thank you very much, Sadhguru. Thank you so much. I think there's so much for all of us to learn, particularly about that last point about actionable compassion. I think if we can look to, do that and bring that in our everyday lives, I think we'll make our society a much better place to live in. So thank you all. Thank you, Sadhguruji, for this. Thank you so much.
I want to thank you also. Sunilji had an illustrious career in cricket, one of those stars which are always shining bright in the sky of sporting world. But he also has been very kind to be a part of the trust that we run, Sri Sathya Sai Sanjeevani Hospitals. And he's now, I always tell, he's now batting for us. He goes around the world, talks about our work, and he's inspired so many people around the world. And anytime he goes for his assignments also, he finds time on the sidelines to go and meet people and talk about our work. He has raised a lot of resources for heart operations, for education, and all other activities. And I'm very grateful that he also came today to interact. And shortly, he's organizing a very beautiful cricket match in this very ashram. The stadium is getting ready. And that cricket match is with this idea, to bring all the countries of the world on one platform, with the idea that we are one world, one family. And like members of the family, we play for the joy of playing, not for winning or losing. Let sports be a unifying force. With this idea, he is organizing and coordinating that event that will happen in mid-January, around that. So again, very thankful to him, and very appreciative of all his efforts. You are definitely putting compassion in action.
Gratitude to Sadguru and Shri Gavaskar ji. We conclude this session. We will have a short break and we'll resume for the valedictory session this evening.